hello. Good evening, good evening. Good evening, everyone. Hello. Hi. Hi, Zimira. Thank you for joining. Hi, Dean Martin. Thank you for joining. Oh, hi, William Moore. How are you? How are you? How's everyone? So, mabilis lang tong live natin. My live would be fast, quick, and straight to the point. Okay. Hey guys, share. Can you share my live? Okay. Before we start, 1 minute to go. Before we start. So, again, hi guys. Welcome to my live. Or to my live. Welcome to my live. First, I want to say thank you so much for dropping by. Whether you're a fellow caregiver, a student, or just a curious about caregiving, I'm really happy to have you here. Okay, so tonight I want to talk about my recent clinical practice experience. So I want to share to you what I've learned, what surprised me, and how those experiences shape the way I see caregiving. And if you ever help take care of someone, let's say your grandparent or a parent or even a patient, I think you'll relate to a lot of what I'm going to share to you. Yes? Okay. So first, I want to ask first my viewers. I want to ask, how have any of you ever helped care for a family member before, or maybe assisting them with bathing or helping them take their medicine? So just drop a heart in a chat box, please. Okay. So if you've been taking care of your parents. So first, I want to share to you my experience in bathing with a patient. So actually, bathing with a patient is more than just getting them clean. Okay. So one of the things I assisted with was bathing a patient with limited mobility. So if you think it sounds so simple, right? But actually, guys, it's not that simple. I'm telling you, it's not that simple. Because for elderly or immobile patient, it's actually a delicate process. Bathing, and also bathing, there's a timeline. Bathing should only take like about 5 to 10 minutes, because if it goes too long, how we all know that elderly patient is really sensitive and fragile. So if it goes too long, they could get tired, get stressed, or get fatigued, or maybe they are chill, or so when you do the bathing, you have to be fast but gentle. So you have to learn to be fast and gentle. Okay, so but before you do the bathing, before you started, so me, I gathered all the supplies, all the needed, like let's say shower gel, towel, of course the clean clothes. And you have to make sure also that the water is not hot, not cold, just warm, just enough for them. So because if it's too hot, then your patient will be feel uncomfortable. If it's too cold, then your patient will get chilled also. So should be warm water, and everything had to be within a reach. So you would not keep moving around like, oh, the clothes, oh, this one. So you don't have to run away. You don't have to leave the patient alone. So that's the most important thing. You don't have to leave the patient alone. So you have to prepare all within the reach, everything like diapers, clothes, towels. So, and also remember also that during the shower, while you're bathing the patient, you have to keep communicating with the patient. You have to keep on checking. You just ask, ma'am, are you feeling comfortable? Is the water okay? Or even because even a little reassuring them, it makes really big difference. So you have to keep talking to them. Are you okay? You're feeling comfortable? So like that, you have to communicate with your patient. Then next is always respect patient privacy. So make sure when you do the bathing in the bathroom, you have to close the door, and then so you have to respect also their privacy. And also while doing the bathing, observe the patient skin. Is there any redness or any rashes also, or any pressure sore that you can find? So you have to also to look on it while doing. And when you're doing the rinse, so rinse thoroughly and pat dry. Don't rub the skin like normally if us when we do the shower, when you have a towel, just rush this like that. So you don't have to do that with your patient, especially to elderly patient. You have to pat it dry. Do not just do like this. Okay, then after shower, apply moisturizer if on the dry skin if it's really necessary, and assess them on dressing while keeping them warm. And then when your patient is settled and comfortable already, you have to it's one of our tasks also to disinfect, to make sure the surrounding is clean. So you have to disinfect and dry the shower as well as the equipment. So I want to ask, have you ever helped any elderly person do the bath, or what was the most challenging part for you? Was it the physical part, or is it the emotional part? So let me know on the in the comment section. Actually, I want to share also what stood out to me was how important it is to check for the things like redness on the skin or sign of pressure sore, especially on the back of your patient here, and the elbow as well, and heels on the feet. You have to check because these are the little things that if you ignore, if you ignore, you just rashes like this, it can lead to a serious infection. So you have to look for it in that one. And the next one I want to share is the bandaging. So normally, normal people, if we do the bandaging, we just wrap it rough, right? So bandaging is not just about wrapping it up, okay? Another part of the training I learned was how to properly apply bandages. And let me tell you, it's not about just wrapping or taping on the wound. So we practice actually on the arms and legs. So arms and legs, like for cuts, swelling, or sprain. Then the head bandages, there's a way. The head bandages is especially tricky actually, because you need to secure them without too much putting pressure on the head. And then the triangular bandage, because the triangular bandage is used for sling for your arm or shoulder injury. And there's a few bandaging techniques. So first one is circular. Circular bandage is for small areas like finger. You just need to wrap it. And then the spiral. Spiral is for forearm and your shin. And then there is a figure of 8. Figure of 8 is when you have the like a sprain on your ankle or your elbow. You have elbow or your knee. And then the triangular bandage. So some of the type of the bandages is I want to show you is this one is a grip bandage or elastic bandage. This one is used actually for sprain and support. So actually this one is the elastic one. So this one is the grip bandage or elastic. And then we have also the adhesive bandage. I have this one, but it's quite big. But there's a small one also. You can put it on minor cuts and abrasion. And then a triangular cloth bandage. So this is the triangular cloth bandage actually. So this one you can use it on during if you need emergency sling, or you're having you need to protect your arm, so you can put this, or you can use it to stop the bleeding. So like there's a bleeding that doesn't stop, so you can put it and just hold it like this, and then you can use this grip bandage to cover it. So and also we also learn who knows here, can you raise your hand, who knows capillary refill test? So I actually will learn also a capillary test. So actually capillary test is making sure that the blood circulation is really flow. So let's say after we wrap our hand or our legs, so we have to make sure that the blood circulation is flowing. So first is you have to press the fingernails, and then let's say if you press, it's turn white, right? Turn white, and then you have to remove. If the color doesn't come back within 2 seconds, so it's indicate that the bandage or the bandage is might too tight, so you have to rebandage again, remove and adjust. So this test can literally prevent lost circulation. So you can try, maybe you can try here. So see, it's turn white, and then when I remove, it's coming back pink. So my blood circulation is working right properly. So I want to ask actually, did you ever learn basic first aid in school, or like how to bandage the wound, or test for circulation? Just comment yes or no on the below. Yes. So yeah, capillary test. So it's one thing I've learned. Actually, at first, when doing the bandaging session, at first I struggle a bit. Yes, I struggle a bit with getting the right tension, because you have to wrap the bandage not too tight, not too loose, right? So, but with practice, it become easier, and it's reminded me that even something that looks simple takes really skills to do it correctly, actually. Because sometimes it's just, oh no, just do this, right? But no, actually there's a proper way on doing the bandages, doing this bandage proper way. It's called figure of 8. So now the exciting part for me to share is I didn't really expect to learn sitting up and using a nebulizer, actually. This device turns liquid medicine into a mist that patient can breathe in. So usually this nebulizer usually used for people who had asthma or with lungs issue like COPD or chronic obstructive pulmonary disease. Also can be used on bronchitis or in pneumonia. So in this session, we were taught that the patients should sit upright. Okay, so should sit upright. If the patient is lying down, you have to put them in a sitting upright position, so the mist reach deep into the lungs. So when they inhale, so it will reach the mist deep in the lungs. And also, not just you have to watch the machine, right? Usually when we do the nebulizer, you're just watching the machine, so if the mist is coming out. But you have to watch the patient also. You have to observe the patient also. Some signs to look out for is like if the patient is feeling comfortable or trouble breathing, or feeling discomfort, dizziness, or the patient is feeling anxiety. So you have to look at on that also. So then after use, you have to clean the nebulizer and dry properly, because otherwise the risk of bacteria growing in the tube is really potential. Okay, so some few steps on the nebulizer is doing setting up nebulizer is you have to, of course, you have to wash your hand. You have to follow the 7 steps of hand washing. Then assemble the machine. You have tubing, medicine cup, mask or mouthpiece. And then after you assemble that one, you have to add medication like salbutamol, or let's say albuterol. And then you need to put also water or water saline. But it's depend on the doctor's instructions. So before you put the medicine, you have to read what was the instruction by the doctor. Okay, and then have the patient sit upright and then let him relax. Start the nebulizer and observe the patient during the treatment and after the treatment. Then clean and dry all the parts after use. Okay, so actually on this session, on this clinical practice, I'll be honest, it wasn't easy actually. I faced a few challenges with bathing. I found it hard. Actually, I found it hard to balance being quick and gentle. And then you have to follow also that timeline for like 5 to 10 minutes. So I was having hard time on that, but I know it will be covered up. It will, because some patient actually needed full-time physical support. And some patient also take time also for you to do the bathing. And with this, you've been tested by your communication, your technique, and your strength. And then, in terms on bandaging, I found out that remembering the step for each type need really focus, and it took you a few tries to get it correctly actually. And in nebulizer, at first I wasn't confident to assemble the parts, and I have to remind myself to focus on the patient reaction, not just the process. So because sometimes we forgot that we have also to look out for patient because we are busy assembling or watching what's happening with the machine. So we have to be both focused. But here's the thing. Every mistakes, every challenges help me improve. I started realizing how much caregiving is more about observation, empathy, and techniques. And remember, you can't do it well unless your heart is in it. So your heart must own what you've been doing. And because of this experience, I've set some clear goals for myself actually. Like first, I want to gain more knowledge with repositioning and supporting fragile patients, and also memorizing and repeating the bandage techniques until they become like a second nature, or like a muscle memory already. Like just close your eyes and you can do already the proper bandaging because it's already on your muscle memory. So I want to that's my goal for myself. And then most importantly, keep improving on how you communicate with patient, because patients sometimes they don't talk, they don't speak up. So you have to learn to read their facial expression, like if they're feeling pain, they feeling happy or anxiety. So you have to read also their face expression and their body language. So that's the little peek into my journey as a caregiving in training. Actually, it's tough, but it's humbling and it's really incredibly rewarding actually. Being a caregiver is not just about doing tasks. It's about being present, being kind, and being skilled as well. If you're also in training or thinking about this path, trust me, it's worth it. Caregiving is something we don't talk about enough, right? But it deserves to be seen and appreciated. So, before I end this live, I just want to say this. Thank you. Whether you're a student like me, a full-time caregiver, or someone's helping loved ones at home, please know that what you do matters. Okay, remember that what you do matters. So caregiving is love in action actually. A love, a real compassionate consistent love is the most powerful force on earth. Okay, so even when it's hard, even when you're tired, remember you are seen, you needed, and what you're doing is heroic. So thank you for being here tonight, and thank you for being you, for trying to help people who needed help. And last thing, if you found this live helpful or inspiring, so just make sure to follow me for more tips and real moments from the caregiving world. if you have questions, whether about caregiving or training or anything else, just feel free to DM me. Okay? So thank you for joining me here. Thank you. I really appreciate it. And have a good night. God bless and bye-bye. See you on my next live on Thursday. Oh, yeah, before I forgot, my next live on Thursday, it's really interesting. I got this idea from one of my classmate in caregiving. Hi Jess. We will talk about caregiving careers. Next live will be Thursday, same time at 9 p.m. So our topic next live will be caregiving careers and the future with EI. So this idea is really when I see this idea, it was like wow. So just see you on my next live to know more. Okay, so bye bye and good night. Have a good night.